I'm going to go over medication administration. I'm going to cover majority of the routes. We're going to do an oral tablet. We're going to do an intramuscular, a sub-Q injection, and an IV push medication. This is our medication administration checkoff sheet. So this is how you're going to be graded during checkoff. Things that we need to look at is make sure that you're doing hand hygiene, provide for privacy, your 2 patient identifiers, which are going to be name and date of birth, verifying that what they are telling you verbally matches their wristband, verifying allergies because there's certain medications that would be contraindicated with certain allergies, vital signs because there's certain medications that can affect vital signs like a blood pressure medication or heart rate medication, or a diuretic. We're taking off fluid. We could see a drop in blood pressure. Reviewing labs, especially if we're doing like electrolyte replacement, we want to make sure we're checking those levels because we don't want to give it if it is too high. Your 3 checks, so your MAR to Pyxis, your MAR to Med, and your MAR to client. Your 10 rights, we want to make sure we have the right client, the right time, the right medication, the right dose, the right route, the right education, the right indication, the right documentation, the right evaluation, and the right to refuse. Then we're going to also make sure we're doing all our medication administration safely. That includes sharp safety. So making sure we're not, we only scooping up for our needles and we're putting them in the proper receptacle. And then you need to be able to identify your sub-Q site injections and your intramuscular site injections. Over here is an example of the MAR that I will be using during my video, for example. Things that we need to look at when we're looking at a MAR is we need to look at the information up here at the top because this is our patient information, so we know we have the right patient. This is going to be your MAR, so that's your medication administration record. That's what that means. So we're looking at the MAR, we're making sure we have the right patient or right client, so that will be our patient identifiers and our MRN number. We're going to verify allergies because there are certain medications we can't give if they have allergies. Time, you want to make sure you're noting the time because that's how you know what meds to give and when to give it. Then we're going to look at diagnosis. Is it appropriate for our patient to get? Is it indicated? For diet, we want to make sure that they have a diet ordered and we need to look at are they eating or not. So if they're NPO, there are certain restrictions. We can't do meds with NPO status, or for insulin, we would have to give the NPO volume versus the eating volume because they're not intaking carbs. And then also if we're doing rapid acting insulin administration, we need to make sure that we have food at the bedside because that medicine can start working within 15 minutes. This patient is complaining of a headache, so that is things to note as well because even though they have these meds that are due, there are certain indications for the PRN medications. So like this patient has acetaminophen, PRN for pain or a headache, and they are complaining of a headache. So I would give this PRN medication as long as they are agreeing to. So we do want to look at the glucose value. So the glucose value is 167. Our patient is a type 2 diabetic, and they do have insulin ordered, and they are on a sliding scale insulin to be given with meals and subcutaneously. So we looked at our order. We know what insulin we're giving. Novolog is a rapid-acting insulin, so we need to make sure that they have food. And it says up here that their food tray has just arrived. So we have food at bedside, so we can go ahead and administer that insulin. The glucose is 167, and it was taken at 8:58, which is just 2 minutes shy of the current time. So that glucose value is accurate, and we can go ahead and treat it. If we're looking at our sliding scale and we look at the range here, that is where our glucose falls. 167 falls between these two numbers. So we are going to give 5 units of insulin. So I would make sure to draw that up and have a second nurse verify before administration. Then some other things I want to look at is vital signs. So this patient does have a history of hypertension, congestive heart failure as well, in addition to the diabetes. So they are going to get their low pressor or metoprolol, and they're going to get some Lasix. So I want to make sure their blood pressure and heart rate are within normal range, if not slightly elevated, because both of those medications could cause a drop in blood pressure, and the metoprolol low pressor can cause a drop in heart rate. So those are within normal range, so we can go ahead and give those, but those are something we are going to continue to monitor with these administration of these medications. So that will be part of the right evaluation in about 45 minutes to an hour after giving the medications. Then we have the pulse ox, which is normal, temperature is normal. And then this is the pain, 3 out of 10. So that's on a scale of 0 to 10. And remember, this patient was complaining of a headache. So they are rating their pain at 3 out of 10. So then that would be another reason why the acetaminophen would be indicated to give this patient. And then they do also have potassium ordered. So with that potassium order, you always want to check their potassium level for their most recent labs. It looks like they had labs drawn this morning at 6 a.m. and it is 5.4. So that is above the range that we would like. We want potassium levels between 3.5 to 5.0. So this is an elevation. So I would not give this potassium because then it would just continue to elevate. Okay, I'm going to show you an example of what we expect for medication administration checkoff. I'm going to follow the medication administration checkoff sheet and go through the steps. All right. Knock, knock, knock. Provide for privacy, hand hygiene. Hi, Miss Mary. I'm Lindsay. I'm going to be your nurse today. How are you feeling? You have a little bit of a headache. Okay. Can you rate your headache on a scale of 0 to 10 for me? 0 being no pain and 10 being the worst pain you've ever felt.
About 3.
It's about a 3. Okay. All right. Well, I'm going to go ahead and look at your medications. It looks like the aide came in and just did a set of vitals on you. So I'm going to look at those and then look at what medications we have available for you, okay?
Okay.
Okay, so it looks like Miss Mary Smith. Can you verify your name and date of birth for me?
Yes, okay. It is Mary Smith, and my birthday is April 19th, 1968.
All right, Miss Mary. I also have on here that you have no known allergies. Is that correct?
Yes, ma'am. I'm now taking it.
Okay, perfect. And it is currently 9 a.m. You have a history of hypertension, congestive heart failure, and type 2 diabetes.
Yes.
Okay. And it looks like they have you on a low sodium diet, and it looks like your tray just arrived.
Yes. Very.
Awesome. It looks like the aide also just took your glucose, and it was 167. So you will need some insulin for that today. Your vitals are blood pressure 132/80, heart rate 86, respiratory rate 16, SpO2 96% on room air, temperature 98.7 degrees Fahrenheit, and your pain, you are rating a 3 out of 10 and you're complaining of a headache. They did also draw your labs this morning and it looks like your potassium was 5.4. So I'm going to go ahead and look at what we have ordered here. And it looks like they went ahead and ordered your flu vaccine. We are in flu season. Are you okay with taking that medication?
Yes, I would like my flu vaccine.
Okay, so just some education on that. That helps prevent the seasonal flu infection or the high severity of the infection. What we're going to monitor at the injection site is going to be any soreness, redness, anything like that. And then, of course, it would be contraindicated if you've had an adverse reaction to a previous flu vaccine. Have you had a reaction to any flu vaccine in the previous years?
No, ma'am, I have not.
Okay, perfect. So we'll just continue to monitor the site and monitor for any allergic reaction. If you feel any different, let me know. But soreness at the site will be expected. Okay, and then next you have your metoprolol or your Lopressor ordered, and that's going to be a 25 milligram tablet. It says here underneath administration instructions to hold if your systolic blood pressure is less than 100, but your systolic is 132, and then hold for a heart rate less than 60, and your heart rate is 86. So we can go ahead and give that medication. Do you have any questions on the metoprolol?
No, I don't believe so. I take that at home.
Okay, good. That is so for your hypertension, we're just going to make sure that it doesn't drop your blood pressure or heart rate too low. So we're going to continue to monitor those and then make sure that if you feel lightheaded or dizzy when you sit up to get up to go to the restroom, please sit back down, call me, and I will help you get up. Okay. And then next we have our furosemide or our Lasix, 20 milligrams IV push. And it says administration instructions to push at a rate of 10 milligrams per minute. So with it being 20 milligrams and pushing 10 milligrams per minute, I would be pushing that over 2 minutes. That is a medication that does need to be pushed slowly. It's ototoxic, so it can cause permanent hearing loss if I were to push it too fast. So I will make sure I'll be looking at my clock and pushing it at the slow rate. Do you have any specific questions about the Lasix or furosemide?
Is that the one that makes me use the bathroom?
It does, yes. So it's going to increase your output. That's the goal. But it will also help relieve those heart failure symptoms that you possibly have with increased swelling or some increased work of breathing.
That sounds great.
Okay, so we'll just continue to monitor that. With this, we also need to look at our potassium because it's a potassium wasting diuretic, and your potassium is actually elevated at this time. So we are okay to go ahead and give this medication. We'll just keep an eye on your intake and output and then daily weights as well. Then we have flushes ordered, so that is for your IV. So for your IV, I will have to go ahead and flush that before and after medication administration, just to make sure that the medication goes into the bloodstream and doesn't sit in your line. Next is potassium. You have a potassium replacement ordered. They commonly order that in addition to the Lasix, but your potassium is elevated at 5.4, so we are actually not going to give that because that's going to be not indicated for you. So we're going to hold that for now, and I'll just let the physician, I'll send him a chat message to let him know. Then we have acetaminophen, 500 milligrams by mouth every 6 hours PRN for a pain or headache. And you actually were complaining of a headache. So would you like some Tylenol for your headache?
Yes.
Okay. Do you have any questions on the acetaminophen?
No, ma'am.
No. Okay. So that one is for mild pain. And we want to make sure that you don't have any liver impairments. We're going to continue to monitor the pain response to that medication. And then last but not least is your insulin. So that is for your type 2 diabetes. We have Novolog ordered, which is a fast-acting insulin. We do have food at the bedside. You are eating, so we are going to give you the dose with meals. And your glucose was 167, so we are going to give you 5 units, and that will be sub-Q. Any questions on your insulin?
No, I'm ready to get my insulin and all my medications.
Okay, so we'll just follow up to make sure that the insulin was effective, but doesn't drop you too low. So if you start to get any like sweaty, feel sweat, cold, clammy, anything like that, let me know. Okay, I'm going to go pull the meds and I'll be right back. Okay, now I'm at the Pyxis station where I'm going to pull out my medications. So the first on my list is the flu vaccine. It's not stocked in my regular Pyxis, so I'm going to go look in my bulk meds. And I do have it in here. So I've got my flu vaccine. Next is going to be my metoprolol. So I'm going to look on my Pyxis map and I'm going to find the drawer for cardiac meds. And that's going to be drawer 6. And metoprolol is in pocket 2. So I find drawer 6, pull it out, and I go to pocket 2. Look at my medication. It's metoprolol 50 milligrams. I'm going to put that there. I just need 1. I'm actually going to have to cut that in half because my order is for 25 milligrams. Then the Lasix is IV push, so that's going to be a push medication. I'm going to go ahead and that is in my bulk meds. And I have furosemide 40 milligrams for. Okay, next medication I need is the furosemide. That is in my bulk meds, so I'm going to pull that. Then I need some flushes, and I have those available. I need potassium chloride. Actually, I don't, because remember, we're holding this medication because the potassium is elevated, so we will not be administering that. We are going to pull the PRN medication, which is as needed for their headache, so that's the Tylenol. Acetaminophen, that is underneath the pain, so drawer 4, pocket 1. And the dose is ordered for 500 milligrams and 1 tablet is 500 milligrams. Next, I need insulin. This one is going to be a multi-dose, multi-use vial, so I need to draw it up here at the Pyxis, scan it, make sure it's correct, have a second nurse verify, and then it will print me off an additional label for my syringe. That will be the label that I scan at the bedside, but the vial itself will go back into the drawer. So insulin is going to be in drawer 3, which is diabetic, and it's going to be pocket 2. So drawer 3, pocket 2, and pull it out, and we have Novolog, which is what was ordered. Okay. Now that I have all my meds pulled, I am going to go ahead and pull my insulin here at the Pyxis. So I'm going to scan, make sure this is the right med. It is. Hand hygiene. Choose my appropriate size needle. When you're administering insulin, you have to get an insulin specific sub-Q needle. So the packaging and or syringe itself should say insulin only. So we want to make sure we have that correct syringe. I'm going to go ahead and take my alcohol swab and clean the top in a circular motion, letting it dry on its own. Any amount that I am drawing out, I have to inject air so I don't create a vacuum. So I'm going to go ahead and draw my syringe to 5 units of air. Going to insert my needle on a hard surface, inject the air, invert the bottle, and draw up my 5 units. Okay. I have not injected this into a patient, so I can recap my needle, but we never recap used needles. And you want to put it on a hard surface or just the sides, but you want to be very careful when recapping. You want to use the scoop method and against a hard surface to get it to click. Now that I've drawn up the 5 units, I want to make sure my charge nurse can verify with me. This is 5 units.
Yep, and it's for what patient?
It is for Mary Smith.
Okay, and her blood sugar today?
It was 167 at 8:58.
Okay.
And she is eating,
Okay,
and so she should get 5 units, and it's Dofalog.
looks correct.
All right, thank you so much. All right, so now that she verified, I have a label attached to my syringe, so I will put the vial back into the drawer. Okay, go ahead and take this off. All right, now I'm going to collect all my supplies and go back to the bedside. Make sure I get a couple alcohol swabs. These blushes, my MAR, and take everything to the bedside. Go in the room, knock on the door, provide for privacy, hand hygiene. Hi, Miss Mary. How are you doing?
I'm doing all right.
Good. We are going to start with your medications this morning. Do you have a preference on what you would like?
I do not. Whatever is easiest for you.
Okay. We'll go ahead and we can just go down the list then. So the first up we have here is your flu vaccine. Now I can do a couple intramuscular sites. It does need to go into the muscle. Would you like it in your deltoid, which is your upper arm here, or would you like it in your vastus lateralis, which is your thigh muscle?
I'll do my deltoid.
Your deltoid? Is this right side okay?
That works great.
Okay. All right. So I'm going to go ahead and verify your name and date of birth.
Aaron Smith. My birthday is April 19th, 1968.
Okay. And I scanned your wristband. It does say I have the correct patient. So that is my first check. MAR to Pyxis is I pulled the meds. That was my MAR to Pyxis. My MAR to med is making sure I have the correct meds. So I have influenza vaccine and the dose is 0.5. The dose is 0.5. Okay. So that is my MAR to med, and then MAR to client was that barcode scanning. I verified name and date of birth, and I did barcode scanning on my patient's wristband. So I have the correct med, and I'm going to have the correct dose. I'm pulling up 0.5 mLs. I'm going to have 2 different needles. I'm going to have one to draw up the medication. Then I'm going to switch out the needle and attach my injection needle. You want to do this because you want to use a blunt needle to draw up your medication because it will decrease the sharpness of the injection needle. So you want to switch out your needles. You don't want to use the same needle to draw up and to inject to your patient. Always make sure you have plenty of alcohol pads. I'm going to go ahead and clean the surface after I do my barcode scanning because I want to make sure that I have the correct med. I scanned my patient already. I'm going to scan my med. And it says we have the right medication. Okay, so I have the right client. I have the right time because it's due now and it is due at 9 and it is 9. The right medication, we verified it's the flu vaccine. The right dose, we verified at 0.5 mLs. The right route, we talked about it being intramuscular. It's going to go into her right deltoid. The right education, I gave her the education on the vaccine, but I'm also going to hand her this vaccine information sheet from the CDC for her to read at a later time. Indication, it is indicated to this patient because she does have some comorbidities that increases her susceptibility, but then also she has not had it this year, so she is due. And the documentation, I will do that once I've administered. Evaluation, I will evaluate after we give the medication so that we can monitor the injection site, and then we talk to the patient and ask her permission, and she did agree to the administration of the medication. So the right to refuse was addressed. All right, so I scans the patient, I scans the med. Now I'm going to go ahead and draw it up. Use my alcohol swab in a circular motion. I have my 3 cc syringe. I'm going to draw it up with my blunt needle. Make sure I have my vial on a hard surface. Okay. And I can recap an unused needle. So since it's not been in my patient yet, I can recap, make sure I put it against a hard surface. Okay, it's 0.5. I'm going to go ahead now and switch out my needles. This was the needle I used to draw up. Place this in the sharps container and attach my injection needle, which I will prime a little bit with the slightest little blib. Here we go. All right, so make sure I have a Band-Aid for my patient and an alcohol for the injection site. All right, Miss Mary, are you ready? Okay, so I'm going to go ahead and administer this flu vaccine in your right deltoid. I did leave this VIS sheet out for you just to kind of read some more information about the flu vaccine. Any other questions before we administer?
Oh man, I'm ready to go.
Okay. Just kind of have your arm kind of over here. I'm going to go ahead and feel for her chromium process. This is right here. Put my arm, my 2 fingers hooked on that and down so I can locate the correct location for my deltoid. Go in a circular motion out. I would let it dry. All right, do you want to count down or just poke?
You can just poke.
Okay, here we go. Like a dart, 90 degrees. Administer. Give it a couple seconds. 2, 3. Go ahead. Sharps container. You're not a bleeder. That's good.
Okay.
And clean up. And then we're going to go ahead and put a Band-Aid on it. And I looked, you have no allergies. Okay, because it's a latex Band-Aid, so I just want to make sure. And you could probably take this off later today. We'll just monitor that site for any redness, inflammation, but it probably will be sore for a couple days, okay? Band-Aid's super sticky. All right, there we go. All right. All right, so next we'll go ahead and document that given date, time, initials. It is the 11th. It's 9 a.m. It was me, and we did the right deltoid. When you're documenting any injections or patches or anything that goes on the skin, you want to also make sure you're documenting the location so anyone after you knows where that medication was administered. Okay, so next we're going to go into your oral medications, which is going to be your metoprolol, 25 milligrams, and then your acetaminophen Tylenol. So scan your wristband. Got the right clients. We're going to look at our medications. We have the metoprolol, which is 50, scan, and it's notifying me, hey, you need to have a partial of this because it's 50 milligrams and what's ordered is 25 milligrams. So I'm going to cut my medication once I've scanned it. You can tell that it can be cut because there is a score on it. But of course, if there's any questions, you can call pharmacy just to verify it can be cut. Okay. And hat. And then you would put the other part of the tablet in the proper receptacle. Waste that medication. Okay. And then for the Tylenol, it is 500 milligrams, and that's what I have is a 500 milligram tablet. Scan. I had already scanned the patient, med. Typically at the hospital, the clinical site, once you scan the patient, you don't have to keep rescanning them as long as you stay in the chart. But once you log out of the chart, you will have to rescan your patient. All right, Miss Mary, do you have any difficulty swallowing?
No, ma'am.
No? Okay, so what I have here is your metoprolol, which I verified your blood pressure and your heart rate are within normal limits, so they're not too low where we need to hold it. So we are going to go ahead and administer that. That is for your hypertension, CHF. And then for your Tylenol, 500 milligrams for your headache.
That sounds good.
Okay, I'm going to go ahead and have some water. You want to wet your whistle first?
That sounds great.
Okay, here you go. And here you go. Sure you're swallowed. Okay,
Thank you.
you're welcome. Okay, so oral medication is complete. I will go ahead and document that. Given today's date, my initial, and the time. For the potassium, we are not giving, so I'm going to put, I can have two options here. I can put not given or I can put held as long as I'm putting a reason why. And that is because the potassium level was elevated and I alerted the provider. Anything you do as a nurse, remember date, time, initials, okay? All right, the last but not least, nope, actually, I have my Lasix too. So Lasix is our IV push medication, so that's going to go through your IV. Are you okay with that?
That sounds good.
Does the IV feel okay?
Yes, ma'am.
It does, okay. So with that, they want 20 milligrams IV push and with a rate of 10 milligrams per minute. So I'm going to push that over 2 minutes. So it might take me a little while to get it. But we can chat. How are you feeling about the holidays coming up?
I have several grandbabies, so I'm a little worried about getting them all something for Christmas.
Oh, I'm sure.
The Bluey these days.
Oh, Bluey's good. I'm going to scan your wristband. I'm going to scan the medication, which is the furosemide. And then I'm going to clean off the top. I have 2 flushes too over here. I'm going to use one to flush before to check the patency of the IV, and then I will flush after to make sure I get all the medication through. So I need to draw up 2 mLs. So I chose a 3 cc syringe. With Lasix, not only do we want to push it slow, but we also want to make sure we are checking that potassium level before we administer because it's a potassium wasting diuretic. And his potassium's elevated, so we are good. Also, his blood pressure is in normal range as well. If it was too low, we would just possibly cause that blood pressure to drop even further. So I have 2 mLs, and I'm going to grab my 2 flushes, and I'm going to go ahead and administer through the IV. Whenever you're opening a new flush, you want to kind of pull back to break that seal and then slowly push the water back up so you see like a little bubble. We don't want to be injecting air into our patients. All right, make sure my IV is good. It doesn't look swollen. It is in date. So I'm just going to clean the lower lock part and attach my flush. Make sure you scan your patient and you scan your flushes. Your flushes are considered a medication. You should flush them. Make sure you have an order for them. So I will flush both or scan both. And then I'm going to just make sure I feel as I flush it to make sure that it doesn't get swollen or the patient has any pain. Mary, do you have any pain? No. Okay. So it flushed good. Now we're going to administer the medication and we will have to run over 2 minutes. As long as I didn't drop the hub here, I wouldn't have to read alcohol. But if I dropped it and it touched something, I would. And then we go over the 2 minutes. We'll say 2 minutes has passed. When you are following it with an additional flush, you want to make sure that you're pushing that flush at the same rate you push that medication, because I'm continuing to push that medication through. So if the medication was meant to be given slowly, I will have to follow the flush slowly as well that I follow the med with. So this will be, again, another about 2 minutes to flush this through. Okay, and complete. Then you want to make sure if it's saline lock, you do saline lock it back. All right, Mary, how you feeling? I feel all right. All right, we have your last one, which is your insulin. So that is your sub-Q injection. You do have a couple options for that. You can do the back of your arm or you can do your abdomen.
We'll do the abdomen.
The abdomen? Okay, sounds great. So let's go ahead, scan wristband. We've already verified we have 5 units. Scanned that. Martapixis is we pulled the med, and then Marta med, and then Marta client. I just scanned the wristbands. We have the right client. The right time is now. Medications, the insulin, the dose is the 5 units. The route is sub-Q, and she chose to have it in her abdomen. I provided the education. It is indicated because her glucose is elevated. Documentation, I'm going to document that it's given once I give it. And in that documentation, I will include her glucose value and the initials of the person who verified my insulin with me. So I'm going to go ahead and take alcohol swab. All right, Miss Mary, go ahead and clean off your injection site. Sub-Q injections, we want to clean from the center out, let it dry. If you can pinch 1 inch of subcutaneous tissue, then you can go at the 45-degree angle with bevel up. If you are pinching 2 inches of subcutaneous, you're going to go at the straight 90. So I can pinch 2 inches, so I'm going to go ahead and go at 90 degrees. 1, 2, 3. Slowly administer, leave it there a couple seconds, then retract, engage my safety. It shouldn't bleed. There we go. If it does, you can give them a little gauze. Put this in my sharps container. And now I'm going to document given. Date, time, initials. And Tiara was the one that verified my insulin and that I did 5 units. And then make sure I document my saline too. I gave 2 flushes. So my order for the flushes is 5 mLs, and I did 2 of those, so it was 10 mLs. All right. And that is what we're looking for medication administration. I'm going to be going over a little bit of dosage calculation from our medication administration video. Using the MAR from that video, we're going to go over how I figured out how much of each of these medications to give. So I have my metoprolol, also known as loperamide, and then furosemide, also known as Lasix. I have 2 different ways in which you can do dosage calculation to figure these out. Now, they might be simpler equations for you to grasp, but I wanted to use them to show you how to set up your problem for the more difficult ones. So for this up here, the equation we have up here is going to be what do we have over the quantity. So what we had is we had 50 milligram tablets and it was 1 tablet. So 50 milligrams in 1 tablet. But what we needed is we needed 25 milligrams. So you're solving for X. We're trying to figure out X here. So you would cross multiply. So 50X, and then 1 times 25 is 25. Then we want to get X by itself. So you would divide both sides by 50, and then your answer would be 0.5. Like I said, this is a typical, easier equation. You could probably do this in your head, but I wanted to show you how to set up your problem. So that is one way to do it. Have over quantity equals desired over X. But then we also have this down here, which is the formula method, which a lot of people find it's easier to grasp. So I wanted to show you how to set up that problem as well. So this would be desired over have times quantity. So desired is we wanted 25 milligrams. What we have is 50 milligrams. And what we have quantity-wise is we had 1 tablet. So when you do the math, 25 divided by 50, you get 0.5. And times the 1, we get 0.5 tablet or half a tablet. So doesn't matter which equation you use to get there, we both got to the same answer. So same thing with the furosemide. We have over quantity equals desired X over here. So it's the same equation used here. What we had is we had 40 milligrams over 4 mLs. And what we needed was 20 milligrams. So we're trying to solve for X. So you want to cross multiply. So we would have 40X, and then 4 times 20 would be 80. And then you want to get X by itself. So you divide both sides by 40, and you get 2 mLs. The other way you could do this problem is the desired over have times quantity. So desired is we wanted 20 milligrams. We have 40 milligrams, and that 40 milligrams is in 4 mLs. So 20 divided by 40 is 0.5, and times the 4 equals 2 mLs. So either way, we get to the same answer. They're just 2 different equations to get there. I hope that helps.